And throughout this outbreak, we've been checking in with health professionals who are on the front lines fighting this pandemic. And this morning, we are joined by Dr. Claiborne Childs, who is the lead hospitalist at Penn Presbyterian Medical Center. Dr. Childs, thanks so much for taking time to join us this morning.
Good morning, Janelle. Glad to be with you.
Glad to have you. And as we just heard the city health commissioner say, it appears as though we are at the peak of this pandemic here in our area. What have you been seeing at your hospital, and have you been seeing any encouraging signs amongst patients?
You know, about 3 weeks ago, at the end of March, we saw a pretty large increase in the number of COVID patients we had in the hospital. And that was a pretty steady increase, but we sort of hit a bit of a plateau over the course of the last week. So the total number of patients with COVID in our hospital has actually been pretty flat over the course of the last 7 days. I think that this is really reassuring. It gives us some hope that maybe we've sort of hit our peak and that maybe we're plateauing. But I want to make sure we're very cautious here. We're not out of the woods yet. So I want to encourage our viewers to make sure they continue social distancing. This has probably been one of the single most important things we've done to really flatten the curve. And so I encourage people to continue social distancing, and hopefully we'll be able to ride this out.
Yeah, social distancing, it seems as though it's helped significantly in terms of flattening the curve, for sure. All right, so speaking of our viewers, we got some questions from our viewers that we're hoping you might be able to help us with. One that I've been hearing a lot from a lot of people is, if you've had COVID-19 and you've recovered, can you get it again, and are you still contagious?
That's a great question. Unfortunately, we don't really know. Usually when you get exposed to a virus, you develop antibodies. Those will often protect you from getting the virus again, getting any virus again. We know that with flu viruses and the virus that causes the cold, common cold, like rhinovirus, these viruses tend to mutate. And so as a result, we often will get a cold several times a year. But coronavirus was sort of an uncharted territory. We don't know really how fast this virus mutates. So presumably, if you've been infected, you probably have antibodies against the virus. But how much of the virus will change and mutate will really determine whether or not you could be infected again. So science is still trying to wrap their brains, trying to figure this one out. So we don't really know for sure.
Okay, and another question that's come up, we've been hearing a lot about plasma injections from people who've recovered. How come we're not seeing this more widely used among critically ill patients, and those who are critically ill, that is, we've been hearing they've been having some difficulty in terms of getting that approved?
Yeah, it's another good question. The whole idea here with plasma injections, again, going back to antibodies, if you've been infected with the virus, presumably you have antibodies against that virus. What they've been trying to do is take blood from patients who've been infected, spin it down to plasma, and take the antibodies, and then potentially inject them into another person to see if that can sort of boost their immune system to fight the virus. There have been some very small studies that have looked at this. Most of them have had no more than 10 patients. So we really don't know exactly how effective it is. For those small studies, they did show some benefit, but we really don't have the scale or have the amount of plasma in the banks to really use this effectively as a treatment right now. What I would say to viewers, if anyone has been infected with COVID-19 and has recovered, the Red Cross is accepting donations. So if you go to the Red Cross's website, there's a form you can fill out if you're interested in donating your blood for them to spin down the plasma for research. I would encourage anyone that's able to do that.
Okay, now shifting gears a little bit here, people have been trying to get outside and get a little bit of exercise responsibly, of course. If you're outside running and there might be other people who are asymptomatic, they don't realize that they're sick, are you at risk if you're passing by them?
So there's sort of two schools of thought on this one. Some would say stay inside. Don't go outside at any cost. Only go outside if there's something that you absolutely need to do. On the other side, we know that outdoor running is great for cardiovascular health. It's also good for your immune system. I tend to fall on that side of the argument. What I would say for people that are outside running, the key is to make sure that you maintain a safe distance of 6 feet from anyone else around you. I'd also recommend not running behind people or running really close to other people. Some other things you might try is in your neighborhood, if there are routes that don't have a lot of foot traffic or not many other runners or people walking around, to try to run those routes. And also try going at times of day when there are not a lot of people outside. So mornings are often a good time, very early in the morning, or sometimes a bit later in the evening. There is some potential risk because you're outside in the community, But I think that if you try these different things when you're running, that this will sort of mitigate your risk.
Okay, and for those who may have a mild case of COVID-19, they're home recovering and they're still dealing with a cough, do you recommend using cough suppressants over the counter?
Yeah, over-the-counter cough suppressants are safe and can be used for COVID infections. They can be used for essentially any upper respiratory infection. So if anyone is home and has any cough, any of the different medications you see over the counter can be used.
All right, Dr. Claiborne Childs, thanks so much for your time. Really appreciate your insight.
Great being with you.
All right, stay safe.